Hello and welcome back to GP Video Podcast by Nadia. So, we are continuing with attention deficit hyperactivity disorder today, and this one is going to be a quick video podcast because I'm on my way to work. So, attention deficit hyperactivity disorder, as I said, it is a very common disorder, the most common neurodevelopmental disorder of generally adults, because when somebody has ADHD, when someone suffers from ADHD, the traits are very much visible and evident from childhood, even less than 5 years of age. You can see these traits as early as the first year of life. So, but usually it is diagnosed between 15 and 12 years of age. And then if the traits are undiagnosed during the childhood, for example, if the traits were mild, not that severe, and they went undiagnosed, parents didn't notice, carers didn't notice, teachers didn't notice, and the condition was never brought into attention of any physician, then it can go unnoticed. But then, because it is a neurodevelopmental disorder and it actually impacts an individual's life in all the aspects, like personal life, professional life, academic life, work life. So even if these symptoms as a child go unnoticed, when the adults grow up, they are like, if they can research about it and they can see that these traits are very much of attention deficit hyperactivity disorder, then they can still come to their GP. GP can refer them to a neurologist or a psychiatrist, and this condition can be diagnosed and can be medicated. So when it's a kid, a pediatrician, a neurologist, or a psychiatrist can diagnose this condition and can start the treatment if needed, because this condition also has two kinds of treatment. One is psychotherapy, one is pharmacologic therapy. Best results are achieved in the combination, but then again it depends on the pediatrician or the psychiatrist and the neurologist. If the symptoms are very mild, pharmacological therapy might not be indicated, psychotherapy could be enough, but it depends. It all depends on the discretion, and this is on the discretion of the psychiatrist or pediatrician or neurologist. The problem is that this condition cannot be cured. The symptoms can be alleviated only, and these symptoms do remain with one throughout the life. Okay, so usually it is a disorder of which is usually diagnosed between 5 years and 12 years old, but it can be diagnosed earlier than 5 years old, and it can be diagnosed as an adult as well. So when we talk about the pharmacological therapy for ADHD is of two types: stimulants, non-stimulants. The first therapy that is given to either adults or kids is always a stimulant, because with the stimulant we start the therapy, and if that either it doesn't work at all, then we go to non-stimulants, or it works but not effectively, then we can add a non-stimulant. But usually stimulants are the first line therapy. There are 3 stimulants in Australia that are available: methylphenidate, dexamphetamine, and lisdexamphetamine. Now these 3 can come in short-term preparations and long-term preparations. Long-term preparations means or extended release preparation means once a day delivery, which then remains in the body throughout, and short-term preparations means the immediate release ones, which are there for 6 to 8 hours or 4 to 8 hours. Depending on what the situation is and what the decision of the specialist is, they can start a patient on both together or on one of them. So, methylphenidate, the long-term preparation is Concerta, and the short-term preparation is Ritalin. Always remember, methylphenidate, the brand name for short-term preparation is Ritalin, which is 3 to 4 times a day, and the long-term preparation is Concerta. Then lisdexamphetamine only comes in long-term preparation, and it's called Vyvanse. And dexamphetamine only comes in short-term preparations. So methylphenidate has both forms, long-term and short-term, while lisdexamphetamine only has long-term, which is called Vyvanse, and dexamphetamine only has short-term. So depending on what drug is chosen by the specialist, it can be both the short acting and long acting can be given, or only long acting can be given, or only short acting can be given. But then depending on the response, which is monitored every 2 to 3 weeks, then it can be tailored. And then the responsibility can be given to the GPs to continue prescribing the same medication and same dose for the rest of the year, and once a year review is recommended by the specialist. Catch you guys later.